Today, we're joined by Julia Michelin, founder and CEO of Dental AI Technologies, a bold new force at the intersection of accessibility, artificial intelligence, and global oral health. With a mission to democratize dental diagnostics, Julia's company developed Nomad Dental AI, an AI-powered platform that delivers dental analysis, care recommendation, and local clinic referrals for people on the move. Her passion for scalable, tech-driven healthcare shines through in every aspect of her work, from building remote diagnostic tools for forming strategic clinical partnerships across international borders. Julia is not just creating software. She's really building an ecosystem that reimagines dental care as something mobile, intelligent, and universally accessible, which I'm really excited to talk to her about all this stuff. Welcome to Dental Tech Talks, Julia. How are you doing?
Oh, thank you so much. I'm doing great, and you? Thank you so much. I'm really happy to be here.
Well, really excited to have you on the show, Julia. Really excited to talk to you. You have a fascinating story, right? You've, I'm assuming that based on the name of your company, of your startup, that there's something nomadic that inspired that. So let's start with this. What inspired you to found Dental AI Technologies? And where did this idea of Nomad Dental AI originate?
Yeah. So I basically have been a dentist for years, and I have lived it and worked in really different healthcare systems. So I think basically that's where everything started. So I'm from Brazil originally, so that's where my accent came from. Then I moved to Ireland and then Australia and then Thailand. So I have experienced really different healthcare systems around the world. And no matter where I was, like one thing that I realized is the dentistry and the dental care is inconsistent. But at the same time, people are getting more connected, more mobile. And so we have this huge gap between the technology that is already available and the technology that needs to be put in dentistry. So that's where dental AI technology came from.
And when you say the gap, is it more in dentistry? Is it more access to care or the quality of care?
Well, it's both actually, because of the inconsistency, you can find really good care, but it's not in a really, no, it's not distributed. So it's like it's unequal. So we are basically using technology to make dentistry more accessible. Like doesn't matter where you are, doesn't matter where are you from. It's like something that you can get access from your phone. So that's the way of bringing this up.
And you mentioned all these different countries that you traveled to. What prompted you to go to so many countries, right? Was it more to experience life and see different cultures? Were what led you to all these travels that then inspired you to start Nomad Dental AI?
Yeah, so basically everything started, I just moved like it's supposed to be just 3 months to learn some English. And then I just started to get more in touch and how dentistry work in other parts of the world. So the difference really fascinated me at the beginning because coming from Brazil and then working in Ireland, and it's so different, but at the same time, dentistry is the same. So how can be really different in terms of, for example, in Brazil, we have so many dental universities. You have so many dental schools. We have a lot of dentists in Brazil. And in Ireland, you just have two. So in Ireland, we have the problem that it's not easy to find a dentist. So that's completely opposite from Brazil, that you have a lot of dentists. So that's why the difference fascinated me. And then I want to know more and more.
Really fascinating. You go to Ireland, you go to Australia, you go to all these different countries. Primary focus was to learn English, obviously get some more experience in the dental space. What experience on a personal or professional level really revealed this big gap that you noticed in access to dental care, especially for, nomadic lifestyle people, travelers or remote communities? Was there something specific where you're like, okay, this is a big problem, we need to solve it?
Yeah. So basically in Australia, I have contact with people all over the world, like really international people from everywhere. And this is like a gap between like I'm gonna wait to arrive into the country that I'm from because I'm traveling. I'm gonna wait 1 year to come back to my country to do the treatment there. And this is like I would start to wonder why people were doing this, why they were like lacking 1 year of the treatment to wait to go to the counter to do the treatment there. So I have a contact with a lot of digital nomads. So basically digital nomads and when you have the flexibility to work in digital, so you can like basically live anywhere. So you have much more flexibility.
And what was the reason that they were waiting to get back to their countries? Because you would think that, there's, medical tourism, right? Some people go to Turkey to get work done. I have friends that travel to other countries or Mexico, for instance. A lot of Californians will go to Mexico to get their work done. Why were they mostly waiting to go back to their own country? Was it because they had universal health care or they already had insurance plans in their own country and they didn't want to splurge while they're traveling in another country?
Well, one thing that I noticed is one of the reason is some of them is because of the healthcare, but then you wait 1 year to do a filling, and then in 1 year it's a root canal, so it's much more complex and expensive. And what I realized is because when you are new in a country, it's not that easy to find trusted dentists. So it was missing this place, this platform that you could trust and you could find trustful dentists, someone to say to you, like, you can go to this dentist because they're good, they are everything's fine. I remember when I was on Nomad Summit, my first Nomad Summit in Chiang Mai, and one of the persons there came to me and say like, because once I went to a fake dentist and I was like, what? And he said, yeah, I went to a place and then it was really strange. It's not sterilized and I couldn't trust anymore. And it's like, it's a trust problem. You need this
Hold on,
place
hold on.
you trust.
When you say when you say fake dentist, can you like elaborate on that? Are we talking about a non-licensed dentist operating out of like their basement at the house where people come in and get their work done?
Well, I had the same reaction, but basically he wasn't feeling safe. That's the thing because he just came to the first dentist that he found on the street, and he didn't like check out. It wasn't recommendation. So this is like we have the thing in dentistry that you need to trust. You need to feel comfortable because of one of the big facts of people are not going to the dentist is the fear factor, right? We all know that people have traumas and a lot of things that come anxiety to go to the dentist, right? So Nomad Dental is basically find trusted dentists whatever you are, especially for digital nomads who are always on the move, who is always traveling for different countries. And you want something easy, you want something, we don't want a difficult thing. We don't want to send an email for the dental practice, you don't want to wait 1 week. We want something in 2 clicks, we want like, I need to go to the dentist. I'm going to the dentist and that's it. And I'm going to receive a good treatment. That's all we need.
Yeah, and we definitely don't want to fake dentists out there, right? When you walk in, we definitely want to have a legitimate establishment where you feel comfortable and you feel like you can trust the person doing work on you.
Exactly. That's the main point. Making something that's supposed to be complicated and complex in easy things, right? Because this is all we want. We want to make life more easy as possible and better for everyone.
Absolutely, and safer. So you're traveling, you're in Australia, you identify this big gap in dental care, access to dental care, and the quality of care, which are both huge. As we both know, dental health is tied, now we're figuring out that it's tied to a lot of other medical health issues. There are a lot of correlations there, including heart, things like that. So you identify the gap. Building an AI healthcare company is not easy. It's no small feat, right? Your background, you're a dentist, you travel the world, nomad dentist, you're experiencing life, learning English, going through all these cool things. What were some of the earlier turning points or validations that told you, hey, I mean, we kind of touched up on it, that this is going to work as an idea. You've expanded on, the problems that you saw, but how did you validate it before you jumped right into it, right? Did you just take a leap of faith and go, hey, you know what? There's a problem. I'm going to jump into it. Let's figure this out. Like, what was that process? I'm really curious.
Basically, the turning point for me, it's like having this background in dentistry. I always felt that it was missing the technological side. So I always like, because I'm a dentist, I'm kind of limited. We don't learn this in dentistry. But when I start to search and being more exposed to image recognition, that was the turning point for me. So basically, when I search and start to learn a lot of artificial intelligence, more focused on like deep learning and image recognition, and I start to see what is available already there in terms of technology. It's like technology is increasing like exponentially. Like you can see models getting better and better. We are living it's a really interesting time to be alive.
I agree. Normally we say, models are getting better by the day, but I feel like they're getting better by the minute. AI time is totally different. So every day we see this big leap in technological advancements, especially in the AI space. It's pretty fascinating. And I agree with you. Very interesting times, also very exciting times to live, especially for at least people like me, where it came from a phone. There was no cell phones, right? I remember dial-up at our place and then having to wait for that sound and then it connects. And now I have Chat GPT on my phone where I can just take a picture of anything in Morocco and it'll translate it. Or, I mean, the possibilities are endless, right? So it's really exciting to be living through these times. So you decide to jump into building this platform. What challenges did you face early on in aligning the technology with your accessibility focused mission?
So basically, the initial challenge for me was learning the technical aspect, but that's the same time really fascinate me. So I think it's just really important to have like just good people around. This is really important because we didn't get yet to the point of the unicorn, like the one person that's gonna do a really successful company, but it's really important to have like people around you to receive some guide in terms of like technology or like expose yourself, like learning with use AI to learn about AI, like that's today, so many great models already, even to learn. So when I got exposed to like, okay, so I started to realize, okay, AI, artificial intelligence, because for me it was like when I started to learn about it. And then I realized that it's from 1950, things like Alan Turing, and then the real concept in 1956 with John McCarthy, and then the backpropagation 89. So it's not a new concept, AI is not a new concept. But like if we think about AI in dentistry, for example, it is a new concept, kind of like compared to AI in a general, where like starting to like machine learning but in dentistry, it's like so many opportunities to use technology, like we have this 3.5 billion people with suffering from oral disease. And at the same time, we have this amazing models doing like years and years and years of like search in like minutes, seconds. You're really living really interesting moments, and the capability of the models are getting better. And we need to bring this into dentistry, into healthcare, to make it accessible, to make it available for everyone, and to make it cheaper.
Absolutely. And I think, it's not, I think there's a common thread in dentistry, which is it's always lagging on the technology side as far as adoption. It seems like it's always trailing a little bit other industries. So I'm happy, and I have to speak with a lot of founders. So it's really awesome to see how many resources are getting poured into dentistry, and really looking forward to how it grows. And you were mentioning, well, I'll save that question actually for in a little bit here. So, we talked about your story, how you got here. Now, let's talk about the platform. All right, let's break it down. How does your AI engine actually assess a user's dental condition from a photo or scan? Because that is pretty mind-boggling. I think, a lot of people, this is going to be extremely helpful for a lot of people, especially when you look into underserved communities, third world countries, rural areas where preventative care is huge and it could eliminate future hurdles on the medical healthcare system. So let's first maybe break it down in terms of like I download the app, like how does it work from a user journey? Can you describe that for us?
Sure. So like for the moment, Nomad Dental is a web page. So you go to the website, nomaddental.ai, and that's, you take like 5 simple photos. So from your phone, from your smile, upper jaw, lower jaw, right and left. So 5 simple photos. And then AI is going to analyze and give you a score. So this is basically Nomad Dental. So based on this score, you can book online consultation and you can receive a dental recommendation of like dental clinic that are our partners. So we have like certificate that they are like good dentists and you're going to receive a good care. And so basically Nomad Dental is using photos from your phone. So it's like that you can take from everywhere. And thinking about the technology already available in dentistry. For example, when you think AI in dentistry nowadays, focus like 90% focus on inside the dental clinic. So we have like analyze X-rays. We have even like robotics, aligned. We have a lot focus inside the dental practice. So we find that it was missing the product that you're gonna give to the normal people. You don't need to be a dentist to have the basic knowledge about what is a decay or what is happening to your own mouth. And that's why we are launching Luma Brush. So basically, Luma Brush is like electric wood toothbrush with the intraoral camera, when you can actually scan and see your own mouth with this really high quality image.
That's exciting. Thank you for sharing that. It's a toothbrush, which you actually use for brushing. And then on top of that, it's an electric toothbrush, but it has a camera inside of it. So is it constantly, every time you brush your teeth, it's kind of looking around and seeing what's going on and then giving you recommendations based on that?
Yeah, so basically I'm gonna show you, I have one here, but it's like the yeah, it's pretty cool. It's the electric toothbrush, like a normal toothbrush, and then you plug the camera here. So you basically have the camera and then you can take photos and videos from the camera. But it's connected with your phone. It's pretty easy connection. And this is the first version of the Luma Brush, right? So this version, it's like you can literally get your phone, just connect it easily, and then you can actually see and scan your own mouth to see what's happening. And then AI is going to analyze and detect. For the moment, we are detecting decay and tartar.
And are you already selling these in the market? Like, can people buy them if I want to order one?
Yeah, we have the waiting list for the moment. We're going to do the big launch in September, but we are doing collaborations with dentists, universities, and patients as well, who is really interesting to be part of the data collection.
That's amazing. Sign me up. I'll take one too.
Yeah, sure. It would be
Yeah, that's
great.
super
No, I sent
exciting.
you. You let me know.
Yeah, really
But it's
exciting
like,
and really, yeah.
yeah, it's really cool. One thing that we are doing with our model, we are collecting data all over the world because this is really important for us because we want a diverse model, right? So as more diverse you have from different parts of the world, you have more occurrences. So this is like the key important for us. We want to make sure we have more diverse image from all over the world.
Yeah, you'll basically have a lot broader data sets, right? So
Yeah.
you're getting, different demographics, different age groups, different areas of the world, different water quality, different diets, which is really interesting because I feel like the more you do this, you're also going to gather a lot of data. Not sure if you can correlate it to the local lifestyles, but to kind of see, hey, this area actually has a lot more tooth decay. What are they eating exactly, right? What is their lifestyle? So I think that could lift the quality of life in a lot of places, the more data you accumulate. So really, the more people buy these toothbrushes, most likely the more information they'll get about their area, which then will improve their life overall. So really, really fascinating. Good. Congratulations on getting to the prototype, not prototype, to the first version of the product, and excited to see more to come. And I can't wait to have you in the podcast once that's fully launched and we could talk about all the things that you learned from that. Uh,
Yeah, it's pretty cool.
Yeah, and on the Nomad Dental AI, you mentioned that you use patented technology. What makes it unique from other teledentistry companies, right? Or dental AI tools in general?
Yeah, so basically, what is different from the others? It's more like in terms of accessibility. We want to make sure it's easy, accessible, and you can prevent. So basically, like going to like working with universities and going to remote areas and bring technology. And if you can solve this, the problem of accessibility in remote areas, and if you can solve this, that in my point of view, with my own experience, because for me, the most difficult scenario of being health and in day with healthcare and when you're always traveling. So that's the challenge. When you are always traveling, you're always like, you're never just in one place. Everything, we built the company to solve real problems. That is, it was actually one in my problems and with people around me. And then I start to notice that it's like, it's everywhere. It's a universal problem.
Yeah, absolutely. And I'd love to connect you with some universities in Morocco if you don't have anyone here yet. For the Luma Dental piece, I just remembered that I wanted to get it out there for you.
Yep, please.
Yeah, so you've mentioned that some type of certification as far as like when people are recommended to dentists, right? So how does your system recommend a care provider? And then do you have a system where you can vet them to make sure we talked about the trust aspect with the dentist and the horrible story that your friend experienced going to a fake dentist in a basement, which I hope he walked out, right? Your friend, I never asked you earlier, did he stay or did he leave that went to the fake dentist?
No, he left. He was
Good.
too scary.
Okay, I'm glad he left. And you'd have had a lot bigger problems. But yeah, what is the vetting process with that? And how do you integrate, different clinics, especially you're going to different countries, different languages? I'm assuming AI comes in really handy with that since it's able to, it really helps with communication. But yeah, how do you vet these dentists that are on your platform?
Yeah, that's great. Actually, the one thing that we want to solve that I said in the beginning is the inconsistent. So in dentistry, we have this problem of inconsistent. Even like you go like to countries like Brazil, and you have these remote areas like Amazon, and then you have like universities bringing healthcare into Amazon that is like part of University of São Paulo actually. So they basically bring some students to Amazon to do the treatments there. So in these areas that have no dental care, no access to dentists at all. But then when they arrive there, that's twice a year, they do mainly extraction because there's nothing to do anymore. And when you bring this technology, like an intraoral camera or like some knowledge or some teleconsultation with a dentist around the world, doesn't matter, you know. If you connect them to a dentist and get like knowledge, okay, so how you prevent this? Work with like kids, things they like education for the population. It's different than just go there and treat, right? What is already there. And then you just do this, then it's like a cycle. It's gonna be more people that need treat and treatment is expensive and it's getting more expensive. And that's a cycle, right? So basically bring this technology with the power of prevention. That's the most important part for us to prevent the disease before it happens.
Yeah, really fascinating. And from a technical standpoint, how do you ensure accuracy? I know when we spoke offline, you mentioned a percentage of accuracy that you guys are having. I'd love to go over that. So it's a two-part question here. One is like, how do you ensure accuracy? And number two is how are you navigating scaling and privacy on a global scale, right? Because, in the United States, you have HIPAA. I'm assuming every country has some form of law in terms of that. This is more probably for Luma, more so than I guess both, because they both touch upon medical records, right? Even if you're just taking a photo, checking your dental, we are touching the healthcare privacy. So, how are you able to do that in the different levels of laws in different countries?
Yeah. So for the moment, we have our model is 93% of occurrence. So it is good, but because we are using as well intraoral cameras, we can bring it to like 98% at least. And because we are doing the data collection in like different parts of the world, the accuracy goes up as well because we are dealing with different types of like population, so it's getting more and more accurate. And yeah, the terms of like how you make sure like data privacy and how you make sure it is like always they move the system is always going to improve itself, and it's gonna bring access to like more countries and more areas that are not receiving dental care. That's another point for us as well. So we are doing a lot of collaborations with universities around the world. And thank you for the universities in where you are. It's going to be great. It's always great to have in touch with universities because people are students are texting me, like they are contacting me and they're asking about like AI in dentistry, and this is really interesting. I received message from all over the world saying like, oh, I'm finishing college like this year or the next year, and I wanted to know about what is happening in AI in dentistry. And this is like really fascinating me that they are asking for this knowledge. They are looking for this, and the patients are looking for this as well.
Absolutely. I think it's the next frontier. Well, it is the next frontier, or the current frontier, I should say, because we're already there. But I always say, well, my thought is in 5 years, maybe 10 at most, it will almost be illegal to diagnose without at least having an AI have a second opinion. So it's kind of like a second opinion for the doctor, just because as these models get better, AI doesn't go to sleep. It doesn't have long days, doesn't have long nights. So as the accuracy goes up, as you mentioned, from 93 to 98, uh, I just believe it's going to tremendously help the doctors and alleviate some of the strains, right? I have a lot of doctor friends. Oftentimes they're overworked. They could be tired. There's personal stuff going on in people's lives, and for that hour, maybe in the morning where you're moving a little sluggish, having an AI that just kind of makes recommendations. I really think, and as we see this model improve, I really believe that it should be mandatory to basically have an AI like what you're building or like Luma actually give you that second opinion.
Yeah, no, that's exactly what you said. And even the best dentist in the world it still has limitations. And so we can see with our human eyes, and then we can execute with our human hands, and that's limitations, of course. And then even when you know that the dentists are like busy, you have all the routine, you have a lot of like dentists getting like burnout and this kind of like mental condition. So we need to use technology. AI is not going to replace the dentist. It's not like, no, it's not going to exist dentist anymore, just AI. No, it's not about this, but the dentist need to be comfortable with the technology. And I'm not saying the technology that is going to be like in 20 years. No, it is already there. So if you are a dentist and if you're not even having like, if you're not even like curious about it, I think it's time because it's here, it's there, and it's getting better and better, and it's going to help you. So use it, learn it.
And it's maturing. The technology's matured. We have a lot more data sets. We're understanding how to use the technology, and the accuracy is higher. And speaking of accuracy, I wanted to ask you a question about that before I forget. So you mentioned you're at 93% accuracy, and we know that we can get it to 98% accuracy, which no offense to any dentists out there, I'm not sure what the percentages of accuracy with dentists. I'm assuming that's like quite high on that scale. But are there any clinical conditions within that percentage of accuracy that AI currently struggles with? And how do you address that diagnostic uncertainty, right? Like, do you communicate that? This is again a Luma questions, and I'm sorry for all the listeners out there because I'm really fascinated by Luma as well. Because I think it's really groundbreaking technology that could potentially really impact the world on the dental care side, especially when paired with dental AI technologies and Nomad Dental.ai. I think there's a lot of cool stuff that you're doing, by the way, Julia. Really impressive. But yeah, are there any limitations in terms of clinical conditions on the AI side currently?
Because we are focused right now in decay and tartar, so that's basically the most common oral disease. So when you think about decades and tartar, that's probably like 80%, but still has like conditions like less probable conditions, so you still have a lot of the other 20% of like oral disease, and of course this is the goal, get like at least like 100%. It would be like amazing, incredible. But if we have a lot to do with this 80%. So this is the key and starter. So when we got to this point, like that you are like, you can be whatever in the world, you just need this toothbrush and your phone to see the image, and then you connect the dentist all over the world with one click. That's that's the goal, That's when we're feel that we are kind of doing something meaningful for the world, doing something for the good, and that's gonna make a difference, right? I think we need to think in like human level.
I agree. Yeah, really, really couldn't agree more honestly. And I see the vision. I see the toothbrush with the camera. I really see this happening here very soon. Yeah, there you go. Yeah. Yeah, I again, I grew up in Morocco where in some areas dental care and healthcare in general is not as accessible. Not because there are no hospitals, but just sometimes just the distance, right? Or like you mentioned, people in the Amazon forest. And so something like this really uh it touches me that you're working on this, and yeah, full support. And anyone out there, check it out. Uh so I have another question for you. How has the perception been so far from users and dental providers, especially in the digital nomad space and travel health space? I'm assuming the nomads are happy about this because they no longer have to walk into a basement like your friend did and go to a fake dentist. So they're really excited. How is the perception from the healthcare providers?
Yeah. So this is really like amazing opportunity because we are like looking for like digital nomads. It's kind of like people who want more accessible and more like mobile, more interaction, connection, and things more like accessible for everyone anywhere. And for the dental side, right, the dental provider, they're really happy as well. For example, based in Thailand right now, and here the dental care it's really good. Like they have a really good dental care, and it's really affordable compared to other countries. So if you compare, the price can be like even like 10 times less compared to like if you pay like in dollar or euro, and here you have a really good high quality treatment for much less. And so this is pretty cool. It's nice that you at least have this option and you can compare and you can even here and whatever you are, you can find those dentists that you can trust and you can communicate. That it's really important as well. And you're gonna be like our partners from Nomad Dental, they are using Luma Brush. So when you arrive to receive the treatment, they're gonna show to you with the image in really high quality what's happening inside your mouth. And based on this image, you can bring and share to dentists all over the world. You can like it's your data, and this is one really important thing as well. Because sometimes we do like x-rays, like the panoramic x-ray, like the LPG, and then stay with the dentist. And then you travel and you go to another place and you don't have this anymore. And how important it is, especially when you do like a root canal, and it's really important.
Absolutely. Do you ever see yourself where, I'm in California and then you make a recommendation like, hey, if you go to Mexico to this doctor, it'll be the price comparison kind of as far as the cost of dental care. Do you see that kind of on your roadmap, perhaps?
Yeah, so this is basically dental tourism, right? Like when you travel to another place to do treatment, as you say, like a lot of people, Americans are going to Mexico, a lot of Europeans are going to Turkey, a lot of people are going to Thailand, a lot of people are going to Brazil. So it's like it's dentistry becoming more universal and more like it's because now okay, now I know that I have this good doctor in this other part of the world, or I am going there for holiday, so I'm gonna have a good time. I'm going to the dentist, and it's not difficult. And it's not difficult. This is what people need to realize. It's not difficult.
Well, it's no longer difficult with platforms like yours. Otherwise, we end up again in a basement. Yeah, which we don't really want that, which is really fascinating. So, roadmap wise, What upcoming features are you most excited about within the next 12 or 18 months? Currently, I can sign up. We can use a toothbrush or my phone to scan my mouth, identify any issues. We have the scans that live within the app. I can be recommended to a dentist. I go there, they take care of me. What do you have on your roadmap beyond that? I know that Luma's incoming right now. So basically, you have a higher quality images and you're also brushing your teeth on the other side, which is cool. I like how you made it, almost looks like a martial arts weapon. It's pretty cool. But, but yeah, what do you have for the next 12 to 18 months on the roadmap? Something that you're really excited about that you'd like to share with us or wouldn't mind sharing?
Yeah, so I'm really excited to expand the dental tourism with Nomad Dental. So I think that's really good countries with really good healthcare that need to be explored more. For example, Thailand and Brazil, and a lot of other places that I want to explore more. And just give them the opportunity to receive people all over the world. You know, this is so nice. When you're inside your dental clinic, you're receiving people from all over the world. You know, this is pretty cool. And it's nice to give this to the dentists, like make this possible for them. It's really nice to bring technology for like normal people into the daily routine so they can see what's happening to their own mouth with Luma Brush. So this is I'm really excited as well. And my goal is always to bring to a new country. So I always like, okay, so it's good. We got this one and we got to this community. Let's go to the next one. These people still need this, and if you think it, they all over the world needed the technology. And so I think the plan is making more accessible, making more universal, and that's literally the goal.
Really fascinating. If you had unlimited resources, right? Like if I was like Julia, you do what you want, full support, unlimited resources on the technology side, financial side. What's one moonshot feature or expansion idea you would pursue?
It's a great question. But in all the levels, or you mean in like Luma Brush
All the
image
levels,
recognition?
all the levels, either
All the
way.
levels.
Yeah, yeah.
Yeah, I think definitely bring this accessible for everyone because it's like a simple tool, looks like a simple tool, but the power is huge. So if I got all the power, I would give one Luma brush for everyone all over the world and connect with like real dentists who can even like prevent or receive like a good care. I think this is, we just need to organize, you know, technology is already here. Dentists are already here. It's not, oh, we need more dentists. We have a good number of dentists. We need more accessibility. You need connect the technology with the dentist, with the patients. And then that's the only way. And it's already there. Technology is already there. The dentist is already there. So let's just connect, make the connection better.
Absolutely. Have you reached out or are you currently working with any NGOs across the globe to help bring that vision to life in terms of getting these toothbrushes all over the world? I know there are a lot of NGOs, at least in the United States, that are really active in the dental space. Are you working with any of them?
Well, not yet, but we are always open for
Open
collaboration
to it?
in all the levels.
Amazing.
Yeah.
So amazing. Any NGOs out there, please reach out to Julia. And last question for you, not related to dental or the business. What is the best advice that you have gotten or heard in your lifetime? Something that really stuck with you.
Well, I think it's looking for something that bring meaning for you. I think that we are living a really interesting moment that technology is evolving really fast and we have a lot of resource to make it happen. So I think a really good advice is like take a moment to look into your life and analyze to make it really different, to do things meaningful for you and for people around. So let's be better, you know, as humanity, let's do good things and let's help each other, you know. I think this is that all we need this all over the world, right? So I think that's
I agree and I love it. Well, Julia, it's really been a pleasure having you and really, really congratulations on all the good work that you're doing. I really believe that combining the Nomad AI platform along with the toothbrush with Luma could really bring a lot of benefit to people all across the globe. Where can people find you? Where can people sign up for the toothbrush, number one? I know there's a waiting list currently. Where can people find you for that? And if someone, where can people, well, nomaddental.ai, very easy to find as far as the platform. It's nomaddental.ai. But where can people find you? If any NGOs that are listening or any doctors that want to work with you or joining a pilot program, where can people find you?
Yeah, so I'm basically on LinkedIn, so Julia Michelin. And for the Luma Brush, we have already the waiting list. So it's lumabrush.ai, and then you can just put your email, and then you're gonna receive all the news and everything about it. And I'm posting as well daily on LinkedIn about AI in dentistry as well. So I'm basically updating daily what is happening in the world and what's the news in AI in dentistry.
Amazing. Well, it's been really a pleasure having you, Julia, and look forward to having you again once you launch Luma full scale. And I look forward to receiving mine as well and join your study. So thank you for being here and joining us today.
Thank you so much. Thank you for your time. It was a great talk.
Absolutely. Likewise.